My name is Matijana, and I'm one of our multidisciplinary team dealing with risk assessment. I will give you short takeaway messages about risk assessment of indoor spaces. And maybe if we think every day a bit about them, maybe they could help us to be more resilient during and after the crisis. I will remind you and us all that by definition, health is a state of complete physical, mental, and social well-being. It is not merely the absence of disease or infirmity. In public health, we use health impact assessment methodology as a holistic and intersectoral assessment approach to assess the risk of health burdens. It means we correlate individual lifestyle factors with cultural and environmental conditions. It is very important for us to think holistic about interactions between health and environment. Do you know that on average we inhale 10 to 30 meters cubic of air per day? Croats, they spend around 39.6 hours a week at work environment. So it means that work environment is one of the important areas for assessing the risk and threats for your health. 4.3 million deaths are attributable to the exposure to poor indoor air quality. We still in Croatia heat on solid fuels, on wood heating oil. Tobacco smoke exposure is very important public health issue in Croatia still. Did you know that suitable natural ventilation means that you have to open window every hour for 5 minutes? In Croatia, according to Croatian Health Statistics Yearbook, in 2019, those diseases and conditions which we can correlate and with air quality, like respiratory diseases, cardiovascular diseases, and dermal diseases, represented significant number in total diseases and conditions. So not only long-term exposure to low air quality, but also short-term exposures increase the number of admissions to health facilities due to respiratory and cardiovascular symptoms in particular. Also, a low air quality increases the use of medications for those symptoms, increases the number of days with limited physical activities or absence for school or work, and naturally has consequent economic negative effects that we all saw during this COVID pandemic. So always health and economics are interconnected. Indoor air contaminants can be physical, like significant temperature or moisture or airflow. Different chemicals can be presented in indoor or outdoor environment, and different biological contaminants. Those are bacteria, viruses, moths. We are exposed to them through respiratory system, nasal, oral cavities, lungs, but also through skin. And very important is to measure universal carriers, particulate matters. So solid particles are carriers or different contaminants, which is very important in objects of cultural heritage because of the dust also. So health outcomes are different. They can be acute, like irritation of the mucous membranes of the nose, mouth, eyes, sore throat or skin, but also general symptoms, headache, fatigue, nausea, and this is sometimes hard to identify, is it from the air or from something else? That makes these assessments more complicated. In case of long-term exposures, blood pressure oscillations, stroke and heart attack, induced carcinogenesis, modified growth and development, which is important for pregnant women and children, and induced pathophysiology, which is important for elderly because in the older age we have reduced renal function. So all those are different symptoms. It is obvious we cannot differentiate and border indoor and outdoor environment that hard. But if we reduce contaminants in outdoor environment, we can also improve indoor environment quality. And we have to be aware, if we have new furniture, new floors from plastic, we also can induce after the some building and reimbursement in indoor environment different contaminants. It is because of all of that very important according to the European strategic frameworks, like for research, innovation, for sustainable development, to invest continuously and to maintain and to monitor all the contaminants indoor and outdoor. New technologies provide us opportunities for development of risk assessment tools. So with information and communication tools and Internet of Things, we can really show the results of monitoring that we do in a very simple language. It is important also in educational purposes, but most of all, it is important for health protection and high work efficiency, in this case, and for librarian and for students. But I don't want to scare you. Hazard is not the same as the risk. So snake on the photograph is not as the snake in the room. So the hazard is a potential source of harm, but the risk is the likelihood that the person may be harmed if exposed to a hazard. So measuring is important. Measuring and monitoring is most important thing in risk assessment. Different indicators we monitor and can measure. Room size, temperature, humidity, even the water leakage days and the rates of the ventilation system. Even this unpleasant smell is one of air quality indicators which we can use to assess the risk in our, for instance, working environment in museum. Everything is written and we have lots of guidances and legal frameworks for assessment of indoor indoor air quality. There are lots of case studies, monitoring publications. Those are the samples how we can do the sampling. We can do direct measurement by air sampling, but we can do indirect measurement by taking swabs from the surfaces. The most usual moths, for instance, isolated in museums are Aspergillus, Penicillium, and Cladosporium. But I have to say, according to the type of the museum, for instance, different bacteria or moths can be identified. I will just show you in city of Zagreb. I hope you can see the video. All those measurements are useless if we don't transparently show them and use them continuously for risk assessment. In city of Zagreb, we have WebGIS application where we put all the measurements from contaminants in water, soil, air, and we transparently show it to the citizens so that they can see what do we do and what the city in Zagreb finances to assess the risk from the contaminants from the environment. So European Union is usually is very sensitive to that. They ask us to develop innovative alert systems. And it is very important to provide transparent and public measurement results. It is also according to the Sustainable Development Goals. And I think with those results in one place and with intersectoral views, different intersectoral views, we can map the priority as more qualitative, and it can help us during and after the crisis. I always like to say Sendai Framework for disaster risk reduction because it says proper planning, design, construction, and nurturing a culture of maintenance saves lives, prevents and reduces losses, and ensures effective recovery and rehabilitation. So at the baseline, prevention is base of everything, but not prevention without the measurement and not prevention without the use of new technologies to help us understand all those data, which are usually in a large number. And most usually I like to cite that the good doctor cures the disease, but the great doctor cures the cause. So it is the baseline of preventive medicine as we do in Institute of Public Health. Thank you.